Vancomycin, also known by the trade name Vancocin. Vancomycin is indicated for the treatment of life-threatening infections, sepsis, and orally can be used for the treatment of Clostridium difficile diarrhea. Vancomycin works as a bactericidal agent. The therapeutic classification is an anti-infective agent. Special considerations for nursing include that vancomycin can cause ototoxicity, nausea, vomiting, nephrotoxicity, anaphylaxis, and red man syndrome. Infection should be monitored closely while on vancomycin, and if cultures are required as part of the anti-infective treatment regimen, these should be obtained prior to starting vancomycin. Blood pressure should also be monitored while on vancomycin. Vancomycin is a dose-dependent antibiotic, and therefore trough levels should be monitored and checked, and dosages adjusted. Peak levels are not necessary and should not be drawn. Vancomycin should be administered over at least 60 minutes per gram of vancomycin in an IV bag no smaller than 250 mils. This is to avoid the incidence of skin irritation and red man syndrome. One important drug interaction of note is that vancomycin, in combination with penicillins, does have a much higher risk of acute kidney injury. Particularly, vancomycin in combination with piperacillin tazobactam, which is a common empiric therapy for sepsis and febrile neutropenia, has an odds ratio of approximately 3 for the development of acute kidney injury. Therefore, this combination should be avoided, especially in patients with long-standing renal disease.
This has been another episode of the Nursing.com MedMaster podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.